Chances are you're here because you've got questions about your heart disease and this therapy known as EECP, external counterpulsation, a non-invasive treatment for angina or heart failure. I'm here because, well, I've undergone EECP treatment myself. I'm Cliff Johnsen, and I'm not an actor or anything, so forgive me if my presentation is a little rough. You can be sure of one thing. I'm going to tell it to you straight, and straight from the heart.
Well, I just couldn't live a normal life. I mean, when you're in pain all the time.
If I went to the mailbox, I'd have to go slowly.
It was just a struggle for me to even get showered.
I would get angina driving my car.
If I would bend over to tie my shoe, when I stood up, I had angina pain.
I pretty much was couch bound or in bed most of the time.
You just can't do anything without getting chest pains.
Did you recognize yourself? I did. I've been there. I had a couple of bypasses and a stent, but the blockages and the pain just kept coming back. I was pretty convinced they'd never see my kids grow up.
It took a real toll on me, day after day after day, not seeing any light at the end of the tunnel.
I knew in my mind that you just progressively got worse.
I got to the point where I just said, I can't do this anymore. I can't live like this. We need to find something that can help me.
For 70 to 80% of the people who find themselves at this point, that something could be Vasomedical's EECP therapy.
There are lots of people out there having angina once a day, once every couple of days, take a nitroglycerin on good medical therapy, who might be able to be benefited from this procedure.
The patient who's going to benefit most from EECP is the patient that has already gone through conventional therapy and still has a diminished quality of life and continues to have symptoms.
We've treated people as young as in their 30s and as old as over 100. Basically, it's the patient who tells us that I have chest discomfort that's interfering with my ability to live life.
These people want to be more active. They are not willing to just be sedentary and continue to keep taking nitroglycerin after nitroglycerin.
It just wasn't the type of lifestyle I'd want to live.
It's not really living. It's existing.
These are people who are active, older people who want to continue to have an active life. And I think we can help them a great deal. 70
to 80% of our patients show a significant improvement after therapy, and that improvement continues to about 55–60% of them after 2 years.
Just like everything else in medicine, no therapeutic intervention is 100% successful. But we've found that the majority of our patients have had a significant reduction in their chest pain, and this has enabled them to exercise more freely, more vigorously, and to enjoy a broader spectrum of lifestyle activities.
I'm impressed that in a neighborhood of 75% of patients who go through this procedure, by the time they're up to 15 or 16 or 20 treatments, they're beginning to notice a difference.
EECP is pretty well tolerated. I have patients in their 80s and 90s that have been able to undergo EECP and have a very good response to treatment.
Nothing punctures the skin. There's no needles or catheters or anything like that.
It's a non-invasive procedure with lower initial risk.
My cardiologist, who I trust very much, said this is our best shot. We should do it, so I decided to go ahead and do it.
And there was nothing to lose by trying this.
I said, this is going to work. And I had that idea all through it. This is going to work.
Having a good attitude increases your odds of success with any treatment. So does taking your meds, making lifestyle changes, and in the case of Vasomedical's EECP therapy, making the commitment.
It requires 35 one-hour treatments. That's clearly important right up front.
They've gotten to know me pretty well at the doctor's office.
So what's going to happen an hour a day, 5 days a week for 7 weeks?
Well, first of all, they're going to have their legs squeezed, whatever their heart rate is, 80 times a minute. And it's a fairly vigorous squeeze.
There's pressure on the lower extremities, which does force blood flow back toward the heart, toward the central circulation, and jousts the body a little bit, but not to too great an extent. And in our experience, patients have had no problem tolerating it.
I fell asleep a few times. Or you can lay there and talk, or you could lay there and read.
They are carefully monitored, so the blood pressure is monitored, the pulse is monitored, the oxygenation is monitored. It's done in a setting where you have typically a nurse or a technician available to, stop it at any time. It's a very, very safe procedure.
How much easier can it get to get your life back?
The patient generally, after about 10 to 15 treatments, starts to feel a difference in terms of how frequently the angina is occurring, how severe it's occurring, how long it's lasting, and continues to improve over the course of the therapy.
That's what all the squeezing and releasing is about. It isn't at all random. Leads, like EKG leads, hooked to the machine help detect your heart rhythm. When the machine is switched on,